Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Our lecture today is respiratory system. Formation of the lung buds. When the embryo is approximately 4 weeks old, the lung bud appears as an outgrowth from the ventral wall of the foregut. Respiratory diverticulum will be formed as ventral outgrowth from the foregut. The appearance and location of the lung bud will be depend on the amount of retinoic acid. When become more amount of retinoic acid increase in amount, the formation will be form of the respiratory diverticulum. Epithelium of the respiratory system, trachea, bronchi, larynx, alveoli originate in endoderm, while cartilage, muscular and connective tissue arise in the mesoderm. The lung bud is in open communication with the foregut. When the diverticulum expands caudally, however, two longitudinal tracheoesophageal ridges will be formed, separate it from the foregut, and these ridges will be formed the septum, and at the end, the dorsal portion of the foregut will be formed esophagus, while the ventral portion of the foregut will be formed the lung bud. Larynx. Internal lining of the larynx originate in endoderm, while cartilage, muscular originate from mesenchyma of 4th and 6th pharyngeal arch. Appearance of the laryngeal orifice will be changed from sagittal slit to T-shape. Laryngeal ventricle bounded by folds of tissue, through and false vocal cords. All laryngeal muscle will be innervated by the vagus nerve, 10th cranial nerve. This is the laryngeal orifice. We become at the T-shape. Trachea, bronchi and lungs. At beginning of the 5th week, then هسه بداية respiratory system we say 4th week of development, while this at 5th week. Each of these lung bud, this trachea and lung buds, will be right and left lung buds. And this is the right lung buds will be formed 3 secondary bronchi, while the left is 2 secondary bronchi, upper and lower lobe, and this is upper and middle and lower lobe. Mesoderm, which cover the outside of the lung, will be called visceral pleura, while somatic mesoderm covering the body wall from the inside will be called parietal pleura, and the space between the parietal and visceral pleura is called pleural cavity. Then parietal pleura, visceral pleura, and the space is a pleural cavity. During further development, secondary bronchi will be divided repeatedly, as we say secondary bronchi at right lung 3, while at left 2. So that tertiary bronchi بالرايت راح يكون 10, while at left is 8, and this is form of bronchopulmonary segment of the adult lung. Tertiary bronchi بعد راح يصير other generation of subdivisions, about 17 at 6 months. Before the bronchial tree reaches its final shape, however, an additional 6 divisions will be formed during postnatal life. إذن بعد الولادة بعد يكون هنا راح يتكون عندنا 6 divisions of the segments. All of these new subdivisions are occurring and the bronchial tree is developed. The lung assume a more caudal position, not cephalic caudal position, so that by the time of birth, the bifurcation of the trachea is opposite the 4th thoracic vertebra. 4th thoracic vertebra. This slide talking about the maturation of the lungs. at up to 7th prenatal month. The bronchioles will be divided into terminal bronchioles, and this terminal bronchioles will be divided into respiratory bronchioles. This is respiratory bronchioles, and this the picture for the respiratory bronchioles will be divided into 3 to 6 alveolar ducts. 3 to 6 alveolar ducts. The ducts end in terminal sac. This duct will be end in terminal sac. Primitive alveoli that are surrounded by flat alveolar cell. This cell will be in close contact with capillaries. In close contact with capillaries. This is important for generating gas exchange, adequate gas exchange, so that a premature infant is able to survive at 7 months. During the last 2 months of prenatal life, for several years thereafter, the number of terminal sac will be increased. ما راح يتوقف لما يولد الجنين، بعدها لعدة سنوات راح يصير أيضا development بالterminal sac. As we say, there is divisions. The type of these cells, flat alveolar cells, which is in contact with the capillaries, this is called a type 1 alveolar epithelial cell. Type 1 alveolar epithelial cell. When these capillaries will protrude, when these capillaries will be protrude into the alveolar sac, will become thinner and protruded mass, and this is will be generate the gas exchange. The intimate contact, as we say, produce gas exchange. This is considered as a blood-air barrier. Blood-air barrier. Mature alveoli are not present before birth. Will be continued development of the lung after birth. In addition, the epithelial cell and the flat alveolar cell, there is another type of cell. Will be say type 2 alveolar epithelial cell. Type 2 alveolar epithelial cell produce surfactant. Surfactant is a phospholipid-rich fluid capable of lowering surface tension at the air alveolar interface. Fetal breathing began before birth. What is the benefit of fetal breathing? Important for aspiration of amniotic fluid. These movements are important for stimulating lung development and conditioning respiratory muscles. While respiratory movement after birth bring air into the lungs, which expand and fill the pleural cavity. Although the alveoli increase in size, growth after birth is due to increase in number of respiratory bronchioles and alveoli. مثل ما نبهنا انه development of the lung ما يتوقف عند ولادة الجنين، لكنه continue after birth. فراح يصير هنا development increase بالسايز بالجروث. السبب لأنه زيادة وين يصير عندنا بالنمبر اوف respiratory bronchioles، مثل ما قلنا راح يصير subdivisions إلى، وأيضا increase in number of alveoli. It is estimated that only 1/6 of the adult number of alveoli are present at birth. 1/6 of adult number of alveoli are present at birth. The remaining alveoli are formed during the first 10 years of postnatal life. through the continuous formation of new primitive alveoli. Absent or insufficient surfactant cause respiratory distress syndrome because of collapse of the primitive alveoli. Because of collapse of the primitive alveoli. Thank you very much.